Romneycare. Romneycare is a disaster. I have friends who live in Massachusetts. They tell me it is an utter disaster. There are nonprofit insurance entities there that are going broke, like Blue Cross Blue Shield. They're not even profit-making entities. You heard Mitt Romney last night talk as if, we got 98% coverage. No, they don't have 98% coverage. That's a flat-out lie. And we want everybody to pay, if they're not going to pay, they have to reimburse the state. They don't reimburse the state. They pay some nominal amount. As in Obamacare. Landmark Legal Foundation is one of the groups litigating against this mandate, litigating against the lies the federal government is spewing to the courts about Obamacare, and the federal government sounds a hell of a lot like Romney spinning on Romneycare. Romney is not opposed to an individual mandate. He repeated it again last night. That's what Rick Santorum got him to reveal. He's for an individual mandate. He doesn't call it that, but it absolutely is. Instead, what we're watching on the various cable shows is clip after clip of Romney skewering Newt Gingrich on the Fannie Mae issue. As if that is going to affect how you live in the next 5, 10, or 20 years. As if that's going to affect whether you get to have your doctor or not. It's of no relevance whatsoever. It's all game playing. It's all drama. It's pathetic. So it was clear that Santorum went into this debate with a plan, with a strategy to talk about conservatism, to tell these two guys to cut it out, and to focus on Romneycare. And he not only focused on Romneycare, he hit them on TARP, which they both supported, and he hit them on cap and trade, which they both supported. Here's Santorum. Cut 9, go.
The problem with the answers from Congressman Gingrich and Governor Romney is that, they didn't always say what they're saying. Governor Romney was the author of Romneycare, which is a top-down government-run health care system, which, read an article today, has 15 different items directly in common with Obamacare. Everything from the increase in the Medicaid program, not just the government is going to mandate you buy something as a condition of breathing, mandate that you buy an insurance policy, something that Governor Romney agreed to at the state level, something Congressman Gingrich for 20 years advocated, that the federal government can force each and every person to enter into a private contract, something that everyone now, at least up on the stage, says is radically unconstitutional. Congressman Gingrich supported for 20 years. Governor Romney supported in the state, a state that is pretty much a model for what Obamacare is going to look like. Highest health care costs in the country, 27% above the average. Average waiting time, 94% of the people in Massachusetts are now insured, but there was just a survey that came out and said 1 in 4 don't get the care they need because of the high cost.
Stop. This is crucial to understand, too. It's raised as a side point, but it is a crucial point. We talk about coverage, who's covered. We never talk about what you actually receive as a result of this coverage, do we? Are you getting quality care? Are you getting timely care? Are you being denied certain types of procedures and tests and medicines? Everybody in North Korea is covered with their government-run health care system. They get nothing. It's an extreme example, but it is an example that is intended to make a point. Go ahead.
You have a card, you're covered, but you can't get care. This is the top-down model that both of these gentlemen say they're now against, but they've been for, and it does not provide the contrast we need with Barack Obama if we're going to take on that most important issue. We cannot give the issue of health care away in this election. It is too foundational for us to win this election.
If you're a conservative, there's not a word there you can disagree with. I don't care what kind of conservative you are. Now, he just told you what Romneycare is, and he's absolutely accurate. Romney's running around the country, said he's going to bring a business approach to governing. But he didn't bring a business approach to governing when he was governor of Massachusetts. He brought a liberal approach to governing, at least with respect to this. The knee-jerk response. More government, more regulations, more coercion, and prices go up, quality goes down, and people are miserable. So here's Mitt Romney. Cut 10, go.
The system that we put in place in our state was something we worked out with the labor community, the healthcare community, business, and the citizens of the nation. We came together.
Stop right there. You see, this is what's interesting to me. So they worked out this program with the labor community, the health community, the business community, and the citizens. What's he talking about? Is that how we run capitalism in this country? A governor sits down, our president sits down with a relative handful of Americans and decides how to map out some kind of a system? Is that what we call capitalism in this country? Of course not. Go ahead.
It was voted by a 200-person legislature. Only 2 voted no. Our system has...
He's got an overwhelmingly Democrat legislature. Only 2 voted no. Well, what does that tell you? Go ahead.
A lot of flaws. A lot of things I do differently. Has a lot of benefits. The people of the state like it by about 3 to 1. We consider it very different than Obamacare. If I were president, day one, I will take action to repeal Obamacare. It's bad medicine. It's bad economy. I'll repeal it.
What Governor Romney just said is that government-run, top-down medicine is working pretty well in Massachusetts, and he supports it. Now think about what that means going up against Barack Obama, who you're going to claim, well, top-down government-run medicine at the federal level doesn't work and we should repeal it, and he's going to say, wait a minute, Governor. You just said that top-down government-run medicine in Massachusetts works well. Folks, we can't give this issue away in this election. It is about fundamental freedom.
It's about fundamental freedom. And he's correct. And did you notice the guy that brought up not just Romneycare, but Obamacare was Santorum? It wasn't Romney because he doesn't want to touch the issue. It wasn't Gingrich because he doesn't want to touch the issue. It was the one guy who throughout his career has been exactly right and has opposed top-down, government-run, universal health care with an individual dictate or mandate. That's why he wants to bring it up. He wants to debate it. He doesn't want to talk about this one worked at Fannie Mae and that one has an investment over here. He wants to go right into the teeth of this because he can. And the other two can't. Did you ever think after the November 2010 election, when conservatives, patriots, Tea Party activists went to the polls in massive numbers with a historic electoral turnout and result, that we'd be turning to a former Massachusetts fairly liberal Republican governor who put in place Romneycare to stop Obama? I mean, sometimes it pays to step back and put things in context. And did you think you'd see so many Beltway conservatives and others flacking for him and using left-wing tactics to attack legitimate conservatives, even though they may have different issues that are problematic and different imperfections and so forth? Did you ever think you'd see that? It's amazing. Anyway, I don't want you to miss this. This is Santorum and Romney. Last clip on this, but it's very, very important. Still on Romneycare and Obamacare. Cut 11, go.
In Massachusetts, everybody is mandated as a condition of breathing in Massachusetts to be able to buy health insurance. And if you don't, you have to pay a fine. What's happened in Massachusetts is people are now paying the fine because health insurance is so expensive, and you have a pre-existing condition clause in yours, just like Barack Obama. So what's happening in Massachusetts, the people that Governor Romney has said he wanted to go after, the people that were free ridership has gone up 5-fold in Massachusetts.
Stop. You want to know why? People drop their insurance, or they're forced off their insurance, and they take a free ride, and then when they need health care, they pay the fine. So you destroy the private health care system. You destroy it because you drive up costs. These companies obviously cannot plan. The people who are paying for private health care are paying through the nose because they have to cover so many additional people. It is a disaster. And this guy's Mr. Businessman. This guy's Mr. Capitalist. And we're supposed to rely on him because he's supposed to have the savvy of the market system. And there's no market system at all here. It is government dictate, whether it's a state or federal government. And what troubles me and Santorum and millions of other people is he hasn't learned his lesson. He argues, well, it's a 10th Amendment issue. And we're saying, fine, you did it in Massachusetts. It's a 10th Amendment issue. But now we want to discuss the philosophy behind it. You chose big government, top-down dictates as opposed to a private sector option, as opposed to health care accounts, and 15 other options on the table that Republicans in Congress have proposed and governors are instituting all over the country. Go ahead, Mr.
Times the rate it was before. Why? Because I'll be happy to give you the study. 5 times the rate it's gone up. Why? Because people are ready to pay a cheaper fine and then be able to sign up to insurance, which are now guaranteed under Romneycare, then pay high-cost insurance, which is what's happened as a result of Romneycare.
First of all, it's not worth getting angry about. Secondly,
when he said that, I didn't even understand what he was talking about. Now I do. He was trying to take a shot at Santorum because editorial writers have been saying he needs to be friendlier. He needs to come across better. So that's what's in Romney's head, to characterize Santorum rather than actually defend the substance of his own program. I'll be right back. You know what would actually help if some of these conservative outlets would look at some of the studies that actually been done on Romneycare by conservative nonprofit organizations and think tanks. National Review itself, National Review Online, Katrina Trinko posted an article back in September of last year from the Boston Herald. The Beacon Hill Institute did a study of Romneycare, and it found, among other things, on average, it cost the Bay State over 18,000 jobs, drove up total health insurance costs in Massachusetts by $4.3 billion, and among other things, slowed the growth of disposable income per person by $376. The Heartland Institute, another conservative nonprofit think tank, they write here, the 2006 reform jeopardized the solvency of private health plans in the Bay State. Unfortunately, insurers' solvency is not something patients, physicians, and voters have reason to observe closely. So the political class suffers from perverse incentives once it starts micromanaging health care. This is my point. I thought Romney was Mr. Capitalist, Mr. Businessman. According to the state's 2010 annual report, today per capita spending on health care in Massachusetts is 15% higher than the rest of the nation, even when accounting for wages and spending on medical research and education in Massachusetts. Because it was politically intolerable to allow premiums to rise in line with the cost of Romneycare, the state's insurance commissioner denied 235 of 276 rate increase requests in April 2010. For a short time, no new policies were offered, and plans suffered significant losses. Now, you didn't hear this in the debate when Romney was defending Romneycare. The next month, Blue Cross Blue Shield of Massachusetts, the state's largest carrier, announced a $55 million provision for anticipated losses in the second quarter alone. Now, you can't have losses like that every quarter without going out of business. So you have a nonprofit losing money, because the government now is in control of it. It is a top-down system. Of the 12 largest carriers, 5 were already operating at a loss. At this point, even if the state allows Blue Cross Blue Shield of Massachusetts to increase rates in line with medical costs, their analysis concludes, that is the Heartland Institute, the carrier will become insolvent in the vicinity of 2017. The other carriers will soon follow. But he defends it. He hasn't learned anything from it. Obama never learns either. That's the problem. I mean, it's even worse than Gingrich supporting the individual mandate for 20 years. Well, he's given it up. Romney still defends it in Massachusetts, and it is destroying the healthcare system in Massachusetts. 5 years after Romney signed his law to great fanfare, the people of the Bay State are beginning to recognize that more government control over health care in the name of universal coverage costs more than advertised. An April poll, I guess this is 2010, conducted by Suffolk University and Boston's WHDH-TV reported that 49% of respondents do not believe Romneycare has helped, while only 38% believe it's working. Now, Romney said last night that one out of every three people, two-thirds of the people in Massachusetts support it, or maybe even said more, 3-1 they support it. And 54% said Romney signing the law likely hurt his presidential chances. But that doesn't sound like 3-1 or two-thirds support it when 49% said they don't believe it's helped. So what Romney's talking about is a 2008 poll in July, while he's ignoring this 2010 poll. It's a dramatic shift. 2008, 2 years after the law was signed, showed 69% favoring the law and only 22% opposed it. So he must be referring to the 2008 poll and ignoring the 2010 poll. The fact is, at least half of the people polled in Massachusetts are unhappy with Romneycare. The fact is that the providers, including nonprofits like Blue Cross Blue Shield, are likely to go insolvent in a 5-year period, or at least many of them are. Healthcare costs are higher and have risen faster than in most other states. Romneycare is a failure. In addition to the abuse of the citizen in Massachusetts as an individual mandate. Now, there may be people who call the program who like it individually because they've benefited from it. Good for them. I'm telling you that's what this poll says. And there are other studies out there done by other conservative and libertarian think tanks and nonprofit groups. If those outlets that are supporting Romney want to take a look at them, if they're serious about their conservatism, rather than cheerleaders jumping all over the place and trashing anyone who disagrees with them. This is why Romney does not discuss Obamacare. This is why he would prefer to discuss whether or not Newt Gingrich is a Reaganite, which is a preposterous argument to suggest that he's not. Now, Romney may be the nominee, ladies and gentlemen. He may well be the nominee. Shouldn't we at least know what we're getting if he is? There were a lot of conservatives who backed Ford against Reagan. There were a lot of conservatives who backed Nixon. So what? I don't play that game here. If Romney's the nominee, I sure as hell can't defend Romneycare. I mean, listen to these people defending it who claim to be conservatives. There's nothing conservative about Romneycare. Nothing. The people who are so upset when Gingrich attacked Romney's Bain Capital background by attacking capitalism, which was a knucklehead move, well, now what do they say? Are they going to defend capitalism and the market system in the face of Romneycare? No, they defend Romneycare. And they look stupid, and they act stupid when they do. I have to get it out of my system. Not just for me, but for you too, I think.